We are ending our 17th weekend, and today is our 34th class in quantum psychotherapy. And our topic today is ethical considerations and best practices in quantum informed practice. And our first subtopic is ethical considerations in quantum psychotherapy. Applying quantum principles to quantum psychotherapy involves navigating a complex intersection of mental health ethics and professional standards. And the primary ethical considerations focus on ensuring client safety, well-being, and autonomy while exploring these emerging frameworks. By prioritizing ethical considerations, quantum psychotherapists can create safe, supportive, and respectful environments for clients to explore their thoughts, emotions, and experiences. Remember, the client is their own healer, their own hero, and their own expert. So applying quantum principles to the mind, often called quantum psychotherapy or quantum psychology, introduces unique ethical challenges that bridge theoretical physics, mental health, and professional conduct. So let's look at the ethical considerations we are looking at. And there are 8 of them. So let's listen attentively. And the first one is scientific validity and professional competence. And this means avoiding quantum mysticism. Practitioners have to distinguish between established quantum mechanics and metaphorical applications to psychology. So presenting unproven theories as settled science can mislead clients. And a concern often termed the quantum hype. Maintaining competence means ethical guidelines from bodies like the American Psychological Association, APA, that require therapists to practice only within their area of expertise. And therapists using quantum models should have adequate training to ensure the intervention is grounded and effective. Ethical consideration number 2, informed consent and autonomy. And this means ensuring that clients understand the principles and practices of quantum psychotherapy, including potential risks and benefits. We have to respect clients' autonomy, and we have to explain their autonomy to them so that they can make informed decisions about their care. And this involves transparency of modality. So the clients have the right to know if the treatment is considered experimental or interpretive framework rather than a standard clinical practice. And therapists have to clearly communicate that quantum models of the mind are often interpretive models rather than established physical facts. And when we get to managing expectations, here is how we go about it. Because quantum change is often described as a sudden or nonlinear So therapists must manage client expectations to prevent disappointment or feelings of failure if traditional slow progress occurs instead. And when we come to vulnerability and informed consent, individuals seeking alternative quantum treatments are often in high psychological distress or have exhausted traditional options, making them more susceptible to therapeutic misconception. So we have to have safeguards that are needed to prevent the exploitation of patients by charging for revolutionary treatments that lag rigorous clinical validation. The third ethical consideration is beneficence and non-maleficence. Do no harm. This means avoiding practices that may cause physical, emotional, or psychological harm. Beneficence is acting in the best interest of the client, promoting the client's well-being and safety. An ethical practitioner has to ensure that quantum-based methods do not replace evidence-based treatments for severe psychiatric conditions. And we need to ensure psychological safety. The observer effect in quantum theory, the idea that observation changes reality, can be empowering, but may also lead to victim blaming if a client feels solely responsible for collapsing a negative reality through their thoughts. The fourth ethical consideration is privacy and data governance and confidentiality. We have to maintain clients' confidentiality, respecting their rights to privacy and autonomy. And that means, as quantum psychotherapists, current encryption for clients' records could be vulnerable. And ethical practice requires staying ahead of these security risks to protect highly sensitive mental health data. As quantum technology advances towards quantum modeling of cognitive data, new privacy risks might emerge. And if quantum algorithms are used for diagnostic assistance, they must be monitored for fairness and transparency to avoid systemic biases. The fifth ethical consideration is social justice and accessibility. We have to ensure fairness, equity in therapeutic alliance, no bias or discrimination. There could be an ethical risk that advanced quantum-based therapies or diagnostic tools will only be available to wealthy populations, exacerbating global mental health inequalities. So justice in healthcare requires that the benefits of groundbreaking research be distributed fairly rather than being restricted by cost or infrastructure. The sixth ethical consideration is risk of delaying conventional treatment. And perhaps the most pressing ethical concern is the risk that quantum healing might be positioned as a replacement for evidence-based interventions. So ethical practices require that these methods remain complementary, and practitioners must not discourage conventional medical or psychological treatment, especially for severe conditions where delay could lead to significant harm. The seventh ethical consideration is professional standards and boundaries. The field lacks defined certifications or specific codes of conduct. So keep clear boundaries and professional relationship and avoid dual relationships and conflicts of interest. And scope of practice means that ethical practitioners must balance using quantum principles as a facilitator for shifts in perspective without claiming to manipulate subatomic particles in the patient's body. And the last principle or the last ethical consideration is self-care. And this means recognizing the potential for burnout or compassionate fatigue. So ethical considerations in quantum psychotherapy or a therapeutic relationship. Listen to this attentively. Because in quantum psychotherapy, there is an entanglement of the field between the client and the psychotherapist. So there has to be particular ethical considerations in quantum psychotherapy therapeutic relationship. In a quantum psychotherapy relationship, the typical boundaries of therapist and client are viewed through the lens of entanglement and observer effect. And this shift goes beyond traditional talk therapy. So the observer influences the observed. And ethically, this means the therapist's internal state, the therapist's biases and moods and expectations isn't just a background factor. It is an active ingredient. And the therapist might unintentionally collapse a client's potential into a specific diagnosis or outcome based on the psychotherapist's own rigid beliefs. So the therapist has to maintain quantum neutrality, holding space for infinite possibilities rather than imposing a fixed narrative on the client's healing journey. The second ethical consideration for this therapeutic relationship is navigating the entanglement. The therapist and the client form a single interwoven system. And this can lead to an emotional blurring that counter-transference, where the therapist feels the client's pain so deeply that they lose the professional distance needed to help. So therapists have to practice conscious disentanglement, acknowledging the deep connection while remaining clear, energetic, and professional, with professional boundaries to prevent burnout and having the client codependent on them. The third is responsibility versus victim blaming. This is a core ethical consideration for the therapist-client entangled relationship. And a core principle is that consciousness shapes reality. And if a client is told that they create their own reality, they may feel shame or guilt for their trauma, for their illness, for their systemic oppression. You might find a client asking, why did I manifest this abuse? So we have to be very, very careful so that responsibility does not turn into victim blaming. The fourth ethical consideration for this therapeutic relationship is avoiding scientism and mispresentation. Quantum sounds high tech and it carries persuasive power. So the risk here is using scientific jargon to bypass a client's thinking or to change or to charge higher fees for revolutionary treatments that lack clinical evidence. So the ethical duty as a therapist is to explain that the quantum principles are being used as a metaphorical framework to aid insight, not as a literal physical intervention on the client's atoms. And the last ethical considerations as far as client-therapist relation is concerned is non-linearity and informed consent. Standard therapy follows a linear goals and objectives path. Quantum therapy embraces nonlinearity, that sudden leap or quantum jump in progress. So the risk here is a lack of clear structure that might leave a client feeling lost or unsure of their progress. So it is our ethical duty to provide an informed consent that should include an explanation that progress may not be as a straight line and that sitting in the unknown is a functional part of the therapeutic process. Our next subtopic or subsection is best practices for integrating quantum principles into therapeutic work. Most of us are already psychotherapists with our traditional methods that we've been using, which are helping clients. And we might be thinking of integrating quantum principles into our existing therapeutic work. And it involves using concepts like superposition, entanglement, and the observer effect as metaphorical or cognitive frameworks to foster psychological flexibility and transformation. So here are the core practices for clinicians. Number one, you as a therapist, you are a quantum facilitator. And you have to recognize that a client's reality is fluid and changeable, not fixed. And your presence as a therapist acts as a compassionate observer that can influence the client's state of being. And by applying superposition for cognitive flexibility, you are using this superposition where particles exist in multiple states simultaneously to help clients hold several perspectives at once. This both and thinking encourages the emergence of new cognitive pathways. And when we are looking at entanglement for interconnection, we are framing emotional states and relationships through entanglement lens to emphasize how clients' well-being is connected to a broader social network and shared humanity. And we are embracing the observer effect and teaching clients that their attention and beliefs can shape their perceived reality. And mindfulness is the tool for observing their thoughts without judging them to create a more balanced mental state. So, what are the best practices? Ongoing education for you as a psychotherapist. You have to stay updated with the latest research and best practices in quantum psychotherapy. 2, you have to seek supervision and consultation when needed, ensuring that clients receive the best possible care. And 3, you have to encourage client feedback, using it to inform practice and improve your therapeutic relationship. So, as we end this presentation, in our previous session, we looked at the pro-session ritual. Now we are looking at a pre-session ritual, especially designed to clear entangled energy between back-to-back clients. Imagine you are in a clinical setting where you are going to see about 6 clients every day. So the ritual we are going to go through today uses the quantum reset concepts to collapse the previous session's field and return you to a state of pure potential, the 0 point field, before the next client enters. And it takes about only 2 to 3 minutes. And this is how it goes. Number 1 is the physical break, and it takes only 30 seconds. You can move your body by standing up, shaking your arms and legs, and this physically breaks the static of the previous seated interaction. And you can wash your hands, and you can use cold water if possible, and mentally intend for the water to wash away any entangled emotions or stories that were in the previous session. Number 2, you can collapse the wave of the previous session, and that takes only 1 minute. And you can exhale after taking a deep breath in, and as you exhale forcefully, visualize the previous session's cloud of information, emotions, and possibilities folding inward into a single tiny point of light that disappears. And you can silently say to yourself, that wave of the previous session has collapsed. That work is complete. I return to the center. The third step is entering the 0 point, and this also takes only 1 minute. And you can place one hand on your heart and breathe slowly. 5 seconds in, 5 seconds out. Imagining yourself standing in a vast empty, dark space, the quantum vacuum. And there is no past or future, no patient yet. You are simply a clean observer. And this helps reset the field. You feel your own energy pull back from the room's perimeter into your own core through the heart. And the fourth step is setting the new observer intention, and it takes only 30 seconds. Here you are opening the space. As you prepare to invite the next client in, you set a specific intention for your observation. And you can say, I am a clean mirror. I hold space for infinite healing possibilities. For you put in the client's name, the name of the client that is coming in next. And finally, before the client comes in, you do a sensory anchor. That click. You can use a physical trigger like clicking a pen or ringing a tiny bell or taking a sip of water to signal to your brain that the new quantum system has begun. I hope that has been very helpful. Now, before we finally come to the end of this presentation, let us go through how we can physically set up the clinical room or office to help maintain these quantum boundaries throughout the day. So in quantum practice, the office from which you are operating acts as the container of the therapeutic field. And your setup emphasizes predictability, neutrality, and energetic grounding to manage entangled state between you, the therapist, and the client. So the first thing we are looking at is the spatial geometry and flow. And what does this entail? The seating arrangement, the exit positive seating. So you have to arrange your furniture so that the client has a clear line of sight to the door. This reduces hypervigilance and it helps the client to feel secure enough to explore deep unconscious material. We also need to look at the angled interaction. How are we positioning the chairs of the client and the therapist? We can position the chairs at a 45 to a 90-degree angle rather than directly across from each other. This allows for better collaborative observation of the client's internal world. And if your space allows, create a paperwork zone or a separate conversation zone. This prevents administrative static from bleeding into the sensitive, energetic work of the session. So if the session is taking place in your office, have a different section where your table and paperwork are, and then have a different place where you are having the session. Let us look at the vibrational and sensory anchors. Those natural textures that are present in the office. You can incorporate wood, stone, and bamboo to ground the space. And stone, wood, and bamboo act as biological anchors for both you and the client to return to the physical body after exploring abstract quantum concepts. We can also maximize sunlight to align the room with the natural rhythms of nature and to reduce sterile energy. And if possible, we can have sound absorbing panels to prevent the outer observer of the outer noise to collapse the internal session and cause decoherence. We can also maintain a clutter-free environment using built-in storage with hidden shelves so that our visual clutter will not act as a distraction, drawing the observer's focus away from the healing potential within them. And speaking of that, we have to make sure that we minimize decoration and we have to choose natural themes, pieces in soft blues and soft greens or earth tones. And these non-intrusive patterns prevent the therapist's personal narrative from dominating the field. And lastly, we have to do a mini reset space. We have to dictate a small corner with a comfortable chair or a plant for your transition as a therapist between sessions. And you can use this chair or that plant the way I use spearmint. You can use it as your physical anchor for the decoherence rituals that we discussed earlier. So as we end this presentation, why do you think we had ethics as the last topic in our quantum psychotherapy classes? And how different are quantum psychotherapy considerations from the traditional psychotherapy considerations that we were trained in? So when we come again in our 18th and 19th and 20th class to finish our quantum psychotherapy classes, the classes are considered finished with this last topic on ethics. In our next weekends, we will be looking at different things, different areas that will help us to transition to integrating quantum psychotherapy to our already existing traditional therapies. Thank you for your presence. wish you a blissful night.